A picket led by the Medical Advisory Committee from Chris Hani Baragwanath Hospital will get underway this morning. It's aimed at calling for urgent government intervention on numerous issues facing public health facilities. These include the planned termination of contracts of more than 800 critical personnel and a waste crisis that has hindered service delivery. Let's unpack this story now. We're joined by the chairperson of the Medical Advisory Committee from the hospital, who is also leading the picket. That's Professor Mmampatla Ramokgopa. Prof, it's great to have you with us on the program this morning. Incredibly disturbing, this story around particularly these 800 COVID-19 appointees, just given the kind of pressure the hospital is already under with its current staff.
Thank you very much, Michelle, for giving us a space this morning to highlight the plight, of the healthcare workers at Chris Hani Baragwanath Hospital, and of course that of the patients, the indigent patients that are served by this hospital. Now, it is something that one needs to begin with characterizing, the state of healthcare at this hospital, and perhaps which represent, the state of healthcare in the rest of the country's public health services. Now, we are dealing with a situation here where we've got a crisis within a crisis. We've for a long time been running with a situation where we did not have enough staff, across the board, doctors, nurses, physiotherapists, occupational therapists, support staff and so forth. Now, the advent of the pandemic, COVID-19 pandemic, brought, to light, the disparities, the acuteness of this situation. And hence we're able to convince the government, to give us 800 or so additional posts, doctors, nurses across the board. Now that really helped a lot to alleviate a catastrophe that could have happened, had the government not acted. So now, but now this did not remove, the whole problem of the chronic crisis that we had find ourselves in. The crisis that has to do with shortages of manpower, the shortages of consumables, equipment, the lack of collection of waste and so forth. And currently, there's a new problem where we find that patients do not even have bread in the hospital. So this is what we're trying to deal with. We're trying to highlight this, after having failed, to impress upon the powers that be, that it will be a mistake, to terminate, the 800 posts. Now we feel that it is important that the world out there know what we're dealing with, but not just to make the government look bad, but to say, look, we are all in the same, we have the same team, and we're trying to build a better health system for the health delivery for our people. So this is what it is all about. We cannot sit back and be comfortable, whereas the town is burning. So we say, all clinicians, all people within the hospital, that we rise up and bring this matter to the attention of whoever cares to listen. Thank you.
Certainly. I mean, there's no overstating the kind of impact this will have on patient care, Prof, if it does go ahead, if the termination of these 800 COVID-19 appointees does go ahead. But then, of course, there's also the impact on the staff themselves.
Yeah, indeed. I mean, when you look at a place like this one, I mean, you ask yourself, I mean, it's such a busy hospital. You look at the numbers of patients that we treat here, but not just the numbers, but the seriousness of the illnesses, that we deal with. I mean, at the height of the COVID-19 pandemic, for instance, we're seeing admitted well over 700 patients. And for that, you needed people to come in, risk their lives. And what we had is that we were able to recruit, beyond what we had then with the little, manpower that we had. And people out there came in, raised their hands, committed themselves, to assist us through this terrible, pandemic. And now at the end of it, no one comes and even make an assessment as to what impact that had in saving the health services. No one comes to even say thank you. The thank you that we see is the one that says, now we're terminating you. And I can tell you, some of these people, 800, are some of the best that we can ever get. And should we lose them, a place like Chris Hani Baragwanath Hospital and its crises will just continue to deepen and won't be able to deliver quality health care to our people.
So there's lip service being paid at the moment from officials in government about the contribution these doctors have made in the 2 years of the pandemic. But when it comes to the decisions that follow, it doesn't add up.
Yeah, there is that, and there's also a question of there's just insensitivity and lack of appreciation of what we're dealing with here. If at least you would have someone from head office to come here, take a walk with us through the hospital, go to the wards, go to the intensive care units, go to our theaters, just to experience and see them with their own eyes and feel it, what we see on a daily basis. And what we're seeing here is a situation that none of the people who make these decisions in their boardrooms, none of them would ever tolerate finding themselves in a situation like this one. And all that we are saying is that, all the collective, of people who are here, clinicians, nurses, and so forth, we all devoted, committed to make this health system to work. And we are saying that, can we now listen to each other? Try to discern as to exactly where does the problem lie. Yesterday the budget was presented. I believe extra billions were thrown into the healthcare system. Now the question it will be, where is that money, going to? If it shouldn't come to those that are actually, day in and day out are toiling, working very hard to make the system work. It is time that we begin to now address the whole question of all the money that we're pouring into this system. Rand for rand, do we get value for the money that we put into it? Or all this billion that we throw in, already, they've got sharks, that are waiting to devour it at the expense, of places like Chris Hani Baragwanath Hospital. And for that to be addressed, it is us who work on the ground in hospitals like this, provincial and national government to sit, and discuss, have a discussion and engagement of exactly what is it that we can do to get out of this, chronic crisis, not just one crisis. You run from one crisis to the other, and that crisis is deepening. And now with a loss of 800 critical posts, I can tell you, now it means that we're adding another crisis over the crisis that we're in. So it's a perpetual crisis.
We've reached out to the Gauteng Health Department, Professor Ramokgopa. We've reached out to Kwara Kekana, who's the spokesperson for Gauteng Health, asking for an interview that would have run parallel to this discussion that I'm having with you. And the response we got from the department, from Kwara Kekana, was that the department is likely to release a statement on this matter at some point today. Prof, before we let you go, you talked about health department officials actually coming to the hospital, as you said, doing a walkabout in the hallways of the hospital, in the ICU. Is there a sense that these decisions are being made at the higher levels without a real sense of what's happening on the ground?
Yeah, Michelle, there's a serious disconnect between those that run our services and those that are at the coalface. A very serious disconnect. And somehow you also get this sense that it's not just neglect, but also lack of insight as to what quality healthcare delivery is all about. And we want to now to say, look, can we please wake up? Time is against us. We do not have enough time to sort out this, but, with all the opportunities that we have and the resilient, workforce that we have on the ground, the commitment, if all that is harnessed, and we engage the people and say exactly what is the problem and what needs to be done, I'm sure we'll go a long way. It cannot be tolerated, honestly, to find patients, going around, being pushed around by young doctors and nurses who are supposed to be looking after the patients. It cannot be tolerated to see all this waste material that is overflowing through the dustbin right through the hospital. Where is the question of the hygiene? What is it that says, now we respect our people and respect ourselves? We can actually do better as far as we see it. And we say we want to challenge, the authorities that it is imperative that we really, sit down and look in these things critically. I mean, it is a joke to say that the Gauteng Health Department cannot, pay 800 workers that are critical for ensuring that its services run properly.
Certainly. Professor Mmampatla Ramokgopa, let me thank you for your time this morning. He's the chairperson of the Medical Advisory Committee